My name is Michael Healy. I'm a dentist working in William Place Dental Aesthetics in Bow in East London. I didn't always want to be a dentist. I knew I'd wanted to do something related to science, and I think when I was quite young, I ended up doing a like a work experience in an orthodontic practice, and I really liked both kind of the science aspect of it and also the patient interaction. It made it really interesting, and each day of that week of experience was something slightly different. You met somebody new, so I always had that in the back of my mind. And when I got to university, they got us in seeing patients quite quickly, and straight away I knew this is what I wanted to do. So it wasn't always on the cards, but as soon as I fell into it, I knew I found what I wanted to do for my career. So I think with general dentistry, the great thing is that we can solve issues, but also prevent them from occurring. If a patient's in pain, we can see them, we can do everything we can to try address that pain. And then follow up afterwards to avoid that from occurring again in other areas, and also helping a patient achieve the smile goal that they have. So it's kind of multifaceted. It's both, problem solving and prevention, and the cosmetic aspect of addressing kind of patient concerns and seeing what they would like to, address in their smile, or if there's any changes that they'd like to make, or if they're happy with it, how do we maintain that? And just really kind of focusing on what the patient brings in and says that they would like to address. I think the most rewarding thing about my job is meeting a patient for the first time who's particularly nervous, or hasn't attended in a long time. And it might be the case that, they have kind of a dental phobia, or they've just been putting it off for years, and it's kind of come to the point that they know there might be a little bit of work needed. Seeing them for that initial appointment where we'll go through, in detail what their concerns are, any issues that they're having, and really just spending the time and listening to what they'd like to achieve from that first checkup after many years of not attending. And then, taking x-rays, photos, a full investigation, and just spending a good bit of time in that first appointment chatting about it, basically. We're not launching into anything, nothing's happening without full discussion, and making sure that that patient who's a bit nervous coming in the door goes away with a clear understanding of what we would like to address, what can be achieved, and making sure that they feel, actually, I'm happy enough to come back to that next appointment, or I'm happy to keep attending in 3 months and 6 months to make sure that it kind of doesn't occur again. So yeah, really kind of, it's very rewarding to start in that position, meet a patient for the first time, and then bring them around to becoming a regular attender, and a regular patient that we see and get to know well as well. I think that my patients value most, the thing that they would value most about me is that I think I'm very approachable and I would listen well, and I suppose knowledgeable as well, as I like to think. But yeah, definitely that, if a patient has concerns, or if they feel that they don't quite understand something that they've heard about, I don't know, maybe a root canal treatment, or different filling types, that they can just say, Michael, what does that mean? Or what would that involve? Or what can I expect? And I'm very open to, discussing whatever needs to be talked about. And just, being approachable, I think. So yeah, I think approachable, good listener, and hopefully, knowledgeable. I really value the feedback that patients give us. Particularly like I was saying about the patients who are a bit nervous, they'll let us know when they come in that they've found the experience very helpful, or they've gotten to the point that they no longer quite fear coming to the dentist. And that feedback means the world to us, being able to bring a nervous patient to that point. Or just generally kind of positive feedback. I really, really do value getting that from patients.